See, there are various definitions whenever you are giving the steroid therapy. How do you define steroid response? Steroid response is proteinuria less than 4 for 3 consecutive days on starting the steroid therapy. Then what is meant by, now the question comes, you started steroid therapy today. After how many days ke baad you need to basically check it? Immediately you give and then check and say steroid resistance you don't do na. So that is the reason qualitative examination must be negative for 3 days after starting the steroid therapy. Then early response, when will you expect it to come? When do you call early response? If the response comes within 4 weeks of starting steroids, when do you call late responder? If the remission is achieved only after 16 weeks, then you call it as a late response. Then when do you call persistent remission? If the patient is in remission for 18 to 24 months after stopping the steroids. Don't worry, we will put all this in the newsformedico.com blog as Telangana JUDA question paper discussion. You can have a review explanations. The term frequent relapse is used when at least 2 relapses occurring in 6 months period or 3 relapses in 1 year. Then when do you call steroid dependence? If at all there is a development of response within 2 weeks, not after 2 weeks. Option B says after 2 weeks. So within 2 weeks of stopping or while tapering the steroid therapy on at least 2 occasions. So there is a reason answer becomes B. B only, no? It was in B or C? Sorry, C. Sorry. B. B or C? Sorry, C. Patients remain remission while on prednisolone, relapse after 2 weeks. They said no, it is within 2 weeks. That's the reason our answer becomes C is what you need to remember. A 2-year-old child has been brought and no chest indrawing, he is feeding well, then how do you want to basically manage? So you have got severe pneumonia, no pneumonia, cough or cold. If there are no signs of pneumonia or no signs of very severe disease, wherein you can be able to manage by oral quatrimoxazole for 5 days. Once more, this is a favorite question, Doctor. Acute respiratory infections in child. What is the WHO protocol of management is going to come in the tomorrow's exam. This is a very good graphical question of matching it. So all the different matches are given. How will brain grow, body grow, mind grow, heart grow, thymus grows. So just review that. Then a 4-year-old cannot copy the triangle. Why? Because when will copying circle will come, doctor? 3 years. 2-stroke cross 42 months. Square is 4 years, triangle is 5 years, union jack is 5 to 6. Horizontal diamond is 6 years, vertical diamond is 7 years, Greek cross is 8 years, cylinder is 9 years and cube is 12 years. Right, doctor? So, if you only think I have studied a triangle, I have studied a rectangle, examiner can ask you anything on the planet in pediatrics, in developmental milestones. So that's the reason, don't forget about this important list. I leave the literature for you on the newsformedico.com blog. Every year, Oscar awards for acting, Nobel Prize for real performing will be given to the people. So, this year why it has been given? 3 guys. Edward Moser, John Keefe and Maybrill Moser this year will share the Nobel Prize. For what? They said there are place cells which help us to map our way around the world. and they part the spatio-temporal scaffold in our brains that will help our autobiographical memory is basically the discovery, and that stays in hippocampus. Like GPS, geographical positioning system in the mobile phone, in the brain, hippocampus will do that function. So that is the reason when you go to the school, you will look at the tree in the ground, you will remember that day's girlfriend or boyfriend to whom you proposed. When you go to medical college, there will be a different bench where you have proposed. And ultimately when you go to home, you will discover that you have got your own spouse to whom without proposing only you are forced to marry. So all that geopositional memories are all present where? They are all present in the hippocampus. Now doctor, Geisbock syndrome typically is what? It is relative erythropoiesis whenever there is any condensation of contraction of the plasma volume is basically called Geisbock. Parkinson's is called the reversible cause of dementia. Many of you might have answered subacute combined degeneration of spinal cord associated with vitamin B. Actually, very early if you detect, you can reverse it. But by the time subacute combined degeneration develops, organically if you can document, that time giving vitamin B12 doesn't. That's the reason you have to be careful to initiate it a little more early. Now doctor, hypokalemic periodic paralysis is a channelopathy. But which channel? It is not potassium channel, calcium channel, calcium channel. So only hyperkalemic. Then opposite of myasthenia gravis is what? What is opposite to myasthenia gravis? Incremental conduction. Eden-Lambert is also considered to be channelopathy. You must know that. Then Hep C infection. All of them are true statements. Fulminant in 0.1%, IgG is ineffective for preventing. Mean incubation period is 50 days. A small revision for the tomorrow's exam. Then pathophysiology of obesity. Very high yielding topic when you go to AIMS All India any exam. Ghrelins or giherlins, whatever you call. So you must be quite sure on all those terminology. So what is meant by CART peptides? CART peptides are considered to be anorexigenic, that is they inhibit the food intake. Then you have agouti related protein, which is a neuropeptide produced in the brain. Agouti related peptide is co-expressed along with the neuropeptide Y, and it will increase the appetite, is what you have to basically remember. AGRP means agouti related peptide and NPY. They both will stimulate the food intake is a true statement, is what you have to ultimately remember. Very good question, because obesity pathophysiology is a favorite topic of the examiner. Now doctor, glucose intolerance can occur whenever there is any chromium, it is associated with chromium among the trace elements. H1N1 does not lead to comorbidity in the most common comorbidity is not COPD, but the remaining statements are all true. Oseltamivir is the Tamiflu, Fluvir is the drug of choice inhibiting the entry of the virus. Then what is wrong about the vitamin deficiency? Vitamin D is not hyperhomocystinemia, but which vitamin deficiency lead to hyperhomocystinemia? Folate. So remaining are all true. Riboflavin deficiency lead to Magneta type of a tongue. Once more doctor, ACLS, BCLS and CPR guidelines. Every entrance they ask a question. Take it granted. Definitely will come in the state MD entrance. So what is not included? What is your guess? Amidon you thought. Any other guess, Maru? Huh? Any other guess? Sri says video freezing, maybe that is not the problem for others. Refresh your browser. Okay. Yeah. Abhiram rightly says atropine. So ACLS algorithms may, what are the primary drugs? Whenever VFib or VTAC is there, then we use epinephrine, vasopressin, amiodarone, lidocaine, magnesium. Essentially, if it is there, epinephrine, vasopressin, but atropine is removed from the algorithm of the 2010 ACLS. So what is removed is nowadays a free question, a common question. What is included, आपको मालूम नहीं हो तो भी problem नहीं है, मगर what is excluded you must know. Bradycardia में atropine, epinephrine, dopamine. तो ATP7A mutation causes what, doctor? Menkes kinky head syndrome is ATP7. Then monoclonal antibody, one monoclonal antibody definitely should come now. So that would be what? Eculizumab. Solteris is a common brand name. Eculizumab is the one which is being used. It is the monoclonal antibody, and that is against the terminal complement inhibitor monoclonal antibody which is being used. Leptospira icterohemorrhagica is the name given. When it is very severe, it leads to development of what, doctor? It leads to Weil's disease. If it is a mild form, you can use doxy or ceftriaxone. Any of the two can be helpful. One question will definitely come on platelet inhibitors, heparin, anticoagulants, most ignored chapter in whichever the pharmacology book, Tripathi or Lange or anything. So doctor, in the treatment of bleeding disorder, you have argatroban, lipuridim. Whenever heparin induced thrombocytopenia is there, heparin is what? Indirect thrombin inhibitor. How? Heparin will go and stimulate antithrombin. Antithrombin in turn inactivates the intrinsic pathway factors. That's how anticoagulant effect of the heparin is achieved. It will not directly go and inactivate the clotting factors. But you have direct clotting factor inhibitors like argatroban, which can be used whenever heparin induced thrombocytopenic episodes are there. HIT is of type 1, type 2. Today only you must go back home and revise HIT, which is a favorite topic of the examiner. Then what is romiplastim? So this is called romiplastim. What is romiplastim? It is a fusion protein analog of the thrombopoietin. Thrombopoietin stimulates the platelet production by the bone marrow, no? So whenever idiopathic thrombocytopenic purpura is there, you can use the romiplastim, which is a thromboplastin analog, in order to stimulate the bone marrow to produce the platelets, is one of the newer strategies. Then you have argatroban, which is a direct thrombin inhibitor effective in HIT. Then thrombotic thrombocytopenic purpura is also thrombocytopenic, but why thrombocytopenia occur there? In thrombotic thrombocytopenic purpura, vascular endothelium has a dysfunction that will cause lot of clotting factor poor, platelet rich thrombi, where all platelets get sequestered in that, and that lead to thrombocytopenia. There you will do plasma exchange is what need to be remembered. Now the patient is having sodium of 125 and potassium of 5 milliequivalents per liter. So how do you want to basically manage her scenario? In her given situation, normal saline will be enough. You don't need abnormal saline. I mean hypertonic saline. So 3% NaCl saline में कितने होता है हर एक लीटर में? कितने milliequivalents of sodium will be there? 514. अगर नॉर्मल saline में एक लीटर में कितना होता? 154. So जरा 514 को इधर उधर घुमाए तो आपको 154 मिल जाता है, वो होता है नॉर्मल सलाइन, है, दैट्स इंपॉर्टेंट। मोडी में व्हाट इज द मोस्ट कॉमन टाइप ऑफ abnormality? Hepatocyte 1 alpha, HNF 1 alpha gene mutation is what you see. What is POEM, doctor? POEMs, P for polyneuropathy, peripheral nerve damage, then O organomegaly, endocrinopathy, then edema, M protein, skin abnormalities, that constitutes the POEM syndrome. Septic shock में, which is the vasopressor which you will be using? Epinephrine or norepinephrine? Norepinephrine is the first choice, and epinephrine is considered only as the next line for the management of the septic shock, is what you need to remember. Then doctor, without a question on little Barter gentleman, JUDA want to not disappoint me, Junior Doctors Association. So एक Barter little gentleman नहीं दिए तो सर डिस्कशन में पागल हो जाएगा, अगर कम से कम एक क्वेश्चन तो मिलना चाहिए. So that is the reason they want to respect the sentiment, but let me tell you, even examiner will respect that sentiment. Barter little gentleman, where is the BP high, where is the BP low, everything you must read, doctor. Barter is like giving loop diuretic, gentleman is like giving थायराइड डायरेटिक. अगर लूप डायरेटिक दिए तो हाइपरटेंशन होता या नहीं होता? नहीं होगा ना. तो इसलिए बार्टर में होता है नॉर्मल बीपी और ए लो बीपी. इट इज ए डिफेक्ट, genetic defect in the ascending limb of loop of Henle, just like loop diuretic goes and inhibits the sodium potassium 2 chloride channel in the ascending limb of loop of Henle, is what you need to basically remember.